Cleft lip and cleft palate are splits or separations in the upper lip and mouth that occur while a fetus develops in the uterus. Babies born with a cleft lip or cleft palate may have difficulties eating, both from the breast and a bottle. They may also have trouble speaking, and they often have fluid behind their eardrum that can affect hearing. Dr. Brooke French has an adult and cosmetic reconstructive practice at the University of Colorado Hospital and is the co-director of the craniofacial surgery program at the Children's Hospital of Colorado, and tells us how she treats this condition.
So cleft lip and palate is a condition in which a child is born with what's considered a birth defect or a facial difference. It can be a combination of lip and palate or isolated therein. It can also be unilateral, bilateral, complete or incomplete, depending on the causative factors. So the cause of cleft lip and palate can be multifactorial. It has an influence from genes. It can actually be related to a syndrome. It can be passed on by parents, or it can be related to the experience of the pregnant parent. Diabetic diagnosis, exposure to smoking or alcohol, or certain medications as it relates to epilepsy might contribute to the evolution of a cleft lip or palate. Cleft lip and palate together is about 1 in 1,600 kids. Cleft palate alone is about 1 in 1,700, and cleft lip alone is much more rare, maybe 1 in 2,800. This is the incidence in the United States. If cleft lip or palate were left untreated, you may have difficulty not only with speaking and eating, drinking. You could potentially have more ear infections, and you might have some of the potentially negative psychosocial implications from having a facial difference that's unrepaired. When thinking about how to diagnose and treat cleft lip and palate, it can often be diagnosed prior to delivery through an ultrasound, say at 20 weeks. Cleft palate may be more difficult to see until the child is born. And other conditions like submucous cleft or bifid uvula may be diagnosed much later if they're not symptomatic at first. So if we do have a prenatal diagnosis, we offer the families counseling. It helps take that level of stress down to something that feels a lot more manageable and treatable. And then we see the families and the baby in our multidisciplinary cleft lip and palate clinic, where they see a multitude of specialists: ENT, plastic surgery, occupational therapy, dietitians, pediatricians, geneticists, audiologists, speech language pathologists. The list goes on and on. It's a rather long day, but we do have a binder, and we follow up with them with an after-visit summary that gives them a lot of the information. And we partner with these families for years to come until they're basically adolescents and above. Surgically speaking, the way to treat cleft lip and palate is if the patient has a cleft lip, it's treated within the first year, usually around 3 to 6 months of age. The lip repair is usually 1 night in the hospital and go home the next day. The palate, we aim for doing that before the child has developed a full ability to speak, because the anatomy is so atypical that they'll learn compensations unless we restore the anatomy to what it should be. And then children might need more surgeries, such as an alveolar bone graft, rhinoplasty or nose surgery, maybe a touch-up, and some children actually need what's called orthognathic surgery. It's a jaw surgery when they're fully skeletal and mature. The permission to have this type of relationship and the ability to affect the type of change in a child who would otherwise really have a potentially really difficult go is just a gift. I mean, being able to watch these children thrive, be totally normal, even exceptional, is really a selfish gift that I get to have with my job.
Dr. Brooke French at the University of Colorado School of Medicine and Children's Hospital Colorado is on the forefront of cleft lip and cleft palate procedures.